Hello, my name is Daniel Duke, and I'm a fourth year medical student presenting our abstract on exploring barriers to implementing an EMS naloxone leave behind program. I have no financial disclosures or conflicts of interest with the material presented here. All right, so despite the problem being placed in a national spotlight, opioid overdoses continue to stay elevated, with 46,000 reported deaths in 2018 per the CDC's latest data. Now, naloxone is more widely available than ever before, but still it may not be within the reach of people that need it most. One way that has been shown to effectively increase access to high-risk populations is through leave-behind programs in which EMS personnel provide naloxone to high-risk individuals as they come into contact with them in the community. Now, we know that naloxone is a life-saving medication if administered in time, and we also know that increasing access to it does not lead to increased risk-taking behavior. But despite that, much stigma exists around the drug and healthcare workers, including EMS members. So our goal was to explore what biases and misconceptions might exist in treating opioid overdoses and what barriers are present to starting an EMS-directed naloxone leave-behind program. So during the fall and summer of 2018, we gathered our data using 25 question electronic surveys that were distributed to 2 local EMS agencies that serve Chattanooga and the 5 surrounding counties. We heard back from 105 respondents, the vast majority of who were male. They were paramedics with more than 10 years of experience in the field. They received 22 calls per week on average. 88% of them administered naloxone 1 to 2 times a week, and over half of them have administered naloxone to the same patient on more than one occasion. Now, when we tried to assess their knowledge, we asked 4 questions aimed at identifying awareness of scientific and medical legal concepts. We used a composite knowledge score to rate the responses, and the average was 1.98 out of 4 questions right. Now, only 22.9% answered 3 to 4 questions correctly. The next section was the attitude section. These statements were scored on a Likert scale. Now, as we look at the following graphs, keep in mind that more red bars represent barriers, while green ones signify a favorable attitude. And first off, 90% of people agreed in some fashion with the statement that naloxone saves lives. The majority of people were in agreement or neutral to the claim that those most at risk of opioid overdose had adequate access to naloxone. But our concern is that this may not actually be the case. Half of the responders felt that administration of naloxone by non-medical persons would decrease opioid-related mortality, and 63% thought that they could train patients to recognize opioid overdose and use naloxone effectively. But only 14% thought that EMS should distribute the naloxone, and 16% believed that naloxone distribution by EMS was a realistic strategy. At the end, when the attitude data was added up, we had a mean attitude score of 3.3, which represented a neutral or ambivalent attitude towards naloxone. At the end, we left an open section for responders to list any concerns that they perceived with naloxone distribution, and 60% of the responders chose to list 1 or more concerns. The most common themes were encouraging risk-taking behavior, which in the literature is known not to be true, and the other theme was that this would not be addressing the underlying problem, which they cited as addiction. When we examined the data, there are no associations with concept knowledge. However, there were some with attitudes, in that we found better attitudes to be associated with the female gender and in EMS workers with a smaller overall rate of overdose calls. Now, we hypothesized that this may suggest there is a rate of empathy exhaustion with increased exposure, but more data would be needed to suggest any causality. What we found overall is that knowledge gaps exist amongst EMS providers when it comes to the use of naloxone. Also, we concluded that there is an ambivalence, or in some cases, even a negative perception of naloxone and leave-behind programs. The data we gathered helped identify areas for educational opportunity. Some important areas that could be addressed, for example, would be showing evidence that does not support the thought process of increasing opioid use being linked with increased naloxone use, as well as showing how leave behind programs could be linked with referral and rehab services to address both mortality and underlying addiction. Insights from this helped start an EMS opioid education program 2019, and we are hopeful that through such efforts and more research, we can begin to reduce burnout and increase empowerment in the field. And finally, as of the winter, we were able to start the first naloxone leave behind program in the state of Tennessee. And to end, I just wanted to say a special thanks to all the EMS workers that participated in the survey, and thank you for taking the time to listen.